Well, guys, welcome back to the class again. Yeah, we spent one and a half hour in the 头痛, that means in headache. Now we move the 牙痛, that means the teeth. Okay, and teeth is shorter, so we are going to finish the two topics before we get another break. Okay, so toothache is really common in even in every large city, just like Toronto, Hong Kong, Beijing, and other cities. The thing is, I do the same thing, right? Not here. Yeah, it should be here. Yeah, and yeah, you guys, the teeth is very important here in Toronto because the insurance will not cover this one. Okay, every time you spend about a few $100 to fix your teeth. Okay. So toothache is also cause a lot of pain inside your body because one of the reasons causing you have a bad breath is because of the teeth. Whenever you smell the bad breath of other people, you just think of three reasons. First one is because of the GI problem. That means the gastrointestinal problem. The second, because of the decayed teeth. And the decaying teeth will cause bad breath too. The third reason may be because of something inside the mouth tumor inside the mouth will cause those, right? So in the mouth, always we find the toothache. The reason may be because of cold, heat, acidic, and sweet. Some people get lack of the immunal layer on the top of the teeth, and then it causes toothache too. So the condition in Chinese medicine we call it the gum atrophy. That means like in the dentist say, the contraction of the gums, and also will cause some toothache here. Okay, and sometimes because of the oversensitivity of the teeth. And how about the etiology? And anytime the patient consulting us about the teeth, I will ask them whether it's in the upper or lower, right? Because we know the teeth is governed by two channels. One is the foot yamen channel. The other is the hand yamen channel. Foot yamen channel means the large intestine, which is running in the lower jaw, while the foot yamen channel, which means the stomach, which will be on the top of that. So anytime you get the heat in your large intestine or stomach, you will get toothache. Okay. And this is one of the reasons for internal. Externally, you also cause, the exopathogen will also cause the toothache. And this exopathogen sometimes will develop from exterior into your stomach and become the fire. This fire will burn up, and then it will, leading to your toothache. And the other reason will be also the kidney. Everybody knows the teeth is the residue of your bone. If I want to see whether your bone is healthy, just observe your teeth, right? Just as a nail. The nail itself is governed by your liver. If you want to see anything wrong with your liver, you just see the nature, the appearance of your nail. Here, it means that the bone is the surface or the residue of the teeth, the residue of the bones. So you can see the bone, and sometimes when you have the kidney yin deficiency, and the empty fire will burn up, and this will also cause a toothache. And some people, eating the sour food, after that they get a toothache. Just like me, a few weeks before, after the Thanksgiving Day, and I choked when I was eating the beef, I choked on the bone, and then I break one of the teeth, and then I went to see the dentist and take the teeth out. Okay, so those will be some of the cause of the toothache. Okay, here.
Sorry, can I just ask a question? Can you just repeat what you were saying, the difference between the hand and foot and the large intestine and the upper jaw versus the lower?
Yeah, you're right.
So which one is which?
Yeah, you mean the upper here? Yeah. The upper here means the foot yamen. Foot yamen is the stomach, which will govern your upper jaw. Okay, while the hand yamen, the large intestine, govern the lower jaw. Okay, so whenever you find the toothache in the upper, and then you just will attribute the fire in your large intestine, just like constipation or something. But when you have the toothache in the lower jaw, and then you can just consider whether this is because the large intestine or not, okay? And the upper will be the lung, the lower will be the intestine in this case, okay?
The lower is large intestine?
Yeah, the lower is large intestine, the upper is the lung. I
The
don't
lung
know.
or the stomach?
Oh, yeah, the stomach, sorry, the stomach, yeah, sorry, okay. I mixed it up, yeah. Yeah. The upper is stomach, lower is large intestine.
So the upper is the foot yang,
Yeah.
Yeah, you're right.
and the stomach, and the lower
It's
is the
hand yang. Yeah, you're right. Yeah, this is all the way we're doing that, okay? And how about the treatment? How about the treatment?
We have to write all this when we put for pathogenetic.
Pathogenesis?
Yeah. All this, we have to write the name.
Yeah. You are ready about pathogenesis for the examination. Yeah, sometimes you need to because
And after we have to write the symptoms for the one, like, for everything what we explain.
you explain. I don't think you need to explain all this pathogenesis there. As I mentioned before, first of all, you have the case study. Second, you have to write down diagnosis. Diagnosis, that means which organ is responsible. Okay, and then you can see that's according to the principle, whether it's a cold, heat, or deficiency, or interior, exterior. I think those are important. And then after that, you can just give the treatment principle. So I don't think you need to write down the pathogenesis. This part just take as reference. Okay. And for example, if you get a case study on teeth, and then you need not answer which channel will be affected, but you know the organ, of course. Okay, you mean the organ just like the stomach or just the intestine. You need to know that. Okay, the channel is not. Okay, how about the treatment? And as you know that 颌骨 this point, LI4, always govern more the face and also the mouth. Okay, so when you're headache, you're looking for the LI4. The other thing is locally. Whenever you get anything wrong with your teeth, we consider about the 假切. 假切is ST6, and also upper the 假切 here is a 下关. Actually, guys, remember there are important points for the stomach channel. One is stomach 1. Here is what we call it the 颈翼, and then what the 西拔 2, and then 1, 2, 4. 4 is here 低腔, and then 6. Okay, and then H 头围. I always remember this. And between the 6 and the H, we get the 7 here. Okay, this is 下关. So in case of this teeth, of course, is around this area. What are the important point? Of course, you know the 下切, I mean the ST6, and also 下关 here. Okay, if you get a headache, even causing your headache, of course, you consider the ST8 too, right? So this side, because the Chinese people always saying that if you get headache, it's much painful than large disease. This is what we mentioned. Yeah, this is very important because teeth will cause lots of problems in people. Okay? And also supplementary points you guys consider 外观. As I mentioned before, this point is very important. 外观, just 2 points about the 阳齿 here. This one, okay. This is what we call it the TE4 here. Just junction here the TE5, about 2 inch about that TE5. TE5, as I mentioned before, important in your headache. Also important in your teeth here. Okay. And why do you need to know whether upper jaw or lower jaw? Because now in this supplementary point, you can see that if the headache, the teeth belong to the stomach, and then you need to add one more point is ST44. We call it knighting. Knighting is actually the water point for the stomach. However, it will help to release the fire too. Of course, knighting is not the most important point. The most sensitive point is one more. You just add one. It's not ST44 but ST45. 45 is very sensitive because it's just near the nail there. It's very narrow. I mean, very shallow. When you put the point there. However, here we are not going to consider it because many people dislike they cannot bear the pain there. So we choose 44 instead of 45, right? And the other thing is urgent. Urgent is here. Yeah, urgent. Okay. When you consider LI, this LI we call it the 向阳. And the second point is urgent. Urgent is here, means 2. And then Sanjians here. Okay, you use urgent here, and here is also the point for the stomach fire. Okay, so when you consider the TUVA, because of the stomach fire, you consider the ST44 and also the urgent, that means the LI2 here. Okay, how about the kidney yin deficiency? Sometimes anything wrong in the mouth, just like the mouth sore, just like you get any cheese sore, and not because of the real fire, because of empty fire. What do you mean by empty fire? Empty fire, that means you cannot find the heat inside your body, but it's just because of the yin deficiency and causing you the empty fire. What we call it the yin deficiency fire. And this yin deficiency fire is always because of the kidney yin deficiency. And this time, please tonify your kidney. And kidney tonify, there are water pond for kidney, which is in KI3. Okay, KI3 is located Tai Chi. It's just between the ankle and also your middle here. Okay, this is the middle. This is KI3 here. Okay, and the other one is Xinjian. Xinjian is the second point of your liver. Okay, again, if you go to liver 1, this is very painful for you. So we choose liver 2. What is liver 2? Liver 2 is just in the junction between the large toe and the second toe in this wet position. And then you get a pin here. Okay, this is Xinjian. Xinjian actually is the sun point. If you consider the mother point and the sun point of the liver, you know, mother point is in Jiquan, and the sun point is in the Xinjian. So anytime you fire, of course, it will sedate the sun point, and Xinjian is the sun point of the liver. So we're going to subdue the fire. Okay, those are explanation for this reason. So here you got the explanation. Why do we got the Hugu? That means LI4. Why do we get the Sache and also Shaoguan? Because we want to smooth regulate the qi and also the Yangming channel, Qingming channel. Okay, auricular acupuncture. As I mentioned before, I just mentioned once. Okay, the ear represents the whole body of our cell, right? And down below here represent the head, and then the ear, the eye, and around this region is the backbone, and the middle here, of course, it represents the heart and also the stomach, and up here we're going to the foot. So you can just make the ear as an inverted fetal baby in there. So you guys are familiar with this one. You can just take a look on those. Of course, each region of this ear can has its corresponding position for your either stomach or your teeth there, right? You can just refer to this picture to for your treatment. And about the prescription in hurt, anytime you get the stomach fire, we consider two formula. One, I'm not going to use this Qingwei-san. Qingwei-san is too strong for that. For Qingwei-san is just for the real fire, What do you mean by real fire? Real fire, that means you yourself feel heat yourself. Also, you get the constipation. Also, you get the red face, and also you get the hoarse voice, and all those because of the real fire. In real fire, we use one formula called the Qingwei-san. Another formula I always like to use is what? It's the unit yen. Whether I can find unit yen or not, I'm not sure. Okay, those are the modification. And also, the other formula for the liver fire invasion. The liver fire is too high and also always invade the stomach. This is in Chinese theory of Chinese medicine on the 5 elements. You know that the wood always interact with the earth. The wood means the liver. The earth means the stomach. When the wood is too strong, it will interact his partner of the stomach. In this case, when using in diagnosis, it means the liver is too strong, and then it will act on the function of the stomach, so the stomach cannot work. Okay, and if you find the tooth is because of the stomach fire, which is invaded by the liver fire, and then you can just consider using this formula. Okay, and this is Longdan Segan Tang. Longdan Segan Tang is get many purpose. Many times we use this not only in the not only in the purging of the liver fire, we can also use in the gynecology and also in the tooth here. Okay, and this is the method. And yeah, and Chinese people, when we talk about toxic, the other thing is it's poison. Okay, toxic is toxic, poison is poison. Toxic means what? Extremely heat. We got toxic. Okay, so toxic heat means what? Means exterior heat causing the patient have much the heat inside the body. And so what is the manifestation? Manifestation will become what? Nose bleeding, gum bleeding, teeth bleeding. Okay, you know why those places have blood flowing out? Because those are the places where the blood capillary will get the very thinnest wall. Okay, if you get the thinnest wall, that means when the blood pressure getting higher and the capillary here will break open and the blood will flow out. Okay, so that's why kids always have nose bleeding, gum bleeding, and because they have much more heat inside the body, that heat will force the blood go astray, right? And according to the pressure. Okay, here you mentioned about that the toxic substance can cause invade the stomach, and then you force the teeth bleeding, and also sometimes it causes nose bleeding in this case. And in addition to that, the patient will always have other concomitant signs and symptoms, just like fever and chill or high fever. And sometimes they're really tired. And I think people suffer from empty heat will have irritable, just feel restless and just feel uneasy. Okay, and severe case will have a bad breath, and also they get the whole body, shoring and those things. And it's easy to see the blood heat in your urine, because when your urine get yellow, it means heat, right? Scanty and dark urine, and also sometimes get constipation. And from the pulse and the tongue condition, it's easy to observe. You know why? Because when you get heat, of course, your tongue will get red, tongue coat will get yellow, while the pulse will be fast, rapid, and also strong in this case. Okay, and what we're going to do is we use one formula which is called the 黄连解毒汤. 黄连 is one of the herbs. 解毒 means you are going to resolve the toxin. So you are going to use this formula to resolve the toxin. So we call it 黄连解毒汤. Okay, this is the decoction. And this, okay, back to the acupuncture again. If you got the toxin, besides the points we are using just for the teeth, just you guys remember we are using the 假切, that means the ST6, 下关, ST7, right? And also you are using the 合谷, SLI, those are basic. However, if you get the toothache, because of the toxin, you consider anything because of the stomach, okay? Anything wrong with stomach, you guys remember, you must consider the middle here, okay? 中脘, the ran 12. And besides the 中脘, or sometimes we include the 天虚 here, or the 狼纹 here, but this is not included in our textbook. But 中脘 is a good point. The other thing is your 内庭, this is ST44, which you included in your previous slide. And 合谷 here too, right? And one point we got the 一门 is we got the 中厥. Okay, this one is the 关冲, and then we got the 一门, we got the also the 中厥 here, okay? And 一门 is also a point in SJ, that means it's 三焦. You guys know that the triple warmer or triple energizer is also important in transportation water here and there. So we also consider the 一门. And one point I never trust is the 劳宫 here. When you hold your finger here, and then between the second and the third, you get here, right? This is really painful. Okay, there get 2 points. One is 劳宫, the other is 秀福. Those 2 points, one belong to the PC, pericardium, the other belong to the heart, right? Those 2 points are really, really important in getting rid of the fire, but we seldom use it because the patient will be afraid of that, okay? And besides the 居期 is here, LI11, okay? And we got the, when we have a toxic heat, we consider all those points, okay? So when you have the information, what you're going to do, you got SJ20, this one, just in the tip of your ear, but not in the ear. But I think this is a point for actually is in your in your brain, in your head here, okay? Just a little bit above your tip of the ear. This is 脚栓, and 小海 here. Remember two names. This is 小海, this is 小海, okay? 小海 in the back here, right? This is 小海. It belongs to SI. The other one is you got a cell belong to the heart. You got a cell height here, okay? And you can see severe toothache. And what are you going to consider? Of course, urgent here, as you mentioned before, and 阳骨 is just here. Okay, this is SI5, just in the middle. It's easy, just opposite to dialing. Dialing is here. This is SI5, okay? And if you got constipation, as I mentioned before, constipation get very two important forms. One is SJ6, the other is KI6. Those are two symptomatical points for constipation. One is SJ6, the other is KD6. Here in the textbook, he also mentioned about ST25, that means thin shoe. Where's thin shoe? It's your navel, it's 2 inch about that, because it's thin shoe, okay, thin shoe. Just in the navel, lateral, just 2 inches lateral, both lateral side of your navel, okay? And liver fire, of course, liver fire, some people consider LI2, but I can tell you the Qianmen is LI14, just about the first rib, second rib, down below your nipple here. The LR14, those places can also be used for getting rid of your liver fire. Okay, and about the auricular acupuncture, I'm not going to mention. But those points you have to take care if you have deal with the case with the tooth with toxin. Okay, those are the adaptation for that. Stomach yin deficiency. Stomach yin means what? Means the food inside your stomach. If your food inside the stomach is insufficiency, what does that mean? That means the fire will rise up. Okay, these are the deficiency fire, the empty fire. This is a formula I always use in my clinic, which is called 鱼女剑. 鱼女剑is to use all sorts of herbs to deal with the yin deficiency fire. And then when you use this one, the headache will be easily overcome in this case because of those nourishing herb, because they will nourish the body by giving more body food to the body. You know, just remember this one. Modification, we are not going to talk about the modification. Kidney yin deficiency. I just want to ask a question. What is it between the kidney yin and the stomach yin? Stomach yin means the water in the stomach, right? The kidney yin means what? Means the general body fluid in the whole body. Okay, those are the kidney yin. So the method for tonifying kidney yin is different from tonifying the stomach yin, right? Because stomach yin is the herb for supplying more fluid into the kidney yin is different. Because here we just know that if there's not enough kidney yin, the kidney fire will be happen. But there's nothing called the kidney fire. You know why? The reason is kidney have no excess disease. Kidney is just a deficiency disease. So then we always say kidney deficiency. But whenever we have kidney deficiency, where does the fire go? The fire will not stay in the kidney. The fire will descend down from the kidney to the urinary bladder. Okay? Every fire generated from the because of the kidney will go down to the urinary bladder. So make the problem in what? In urination. Sometimes you get the hot sensation or you get the pain sensation after urination. Those are because of the kidney fire. But the kidney fire will descend down, become the urinary fire. Okay? So in this case too, the kidney deficiency always cause one, you got the heat sensation in the urination, or when it goes up, it causes the toothache. Okay, so here mentioned about that. Some people have suffer from toothache with the loose tooth. Why? Because of the gum. The gums are swollen. Okay, when they get swollen gum and also the loose teeth, and then we mention that this is because of kidney deficiency. Even you go to see a dentist, they just give you some painkiller. However, you cannot cure the root problem. Okay, so here we use a very important formula called the Louis D. Wang. That means there's 6 the 6 types of herbs, including D1. Okay, of course we have done some modification. This is the method, and the other reason for your toothache is because of the qi and bud deficiency. Qi and bud deficiency. Bao Zhen Tao, I mentioned this before. Okay, it's a representative formula for that. And some people suffer from toothache because of stagnated blood. Of course, as I mentioned before, you got stagnated blood. It's not only the teeth get it, our whole body will get the general aching. And also you can see some spider mark if it's serious in the face, or some blue stain on the top of the tongue. Those were the sign for the stagnation. And there's a very famous formula for getting rid of those foot blood stagnation. We got the 血符煮鱼汤. 血符煮鱼汤. 血符煮鱼汤 actually composed of few important formula, just like the 桃红西乌汤 and also what we call it the排脓散. And those are the sub formula inside this formula. Okay, you just remember the name as I mentioned before. No need to know the modification and others. Okay. So just give 1 minute to review on the toothache. See what question you want to ask. No? Good. Because toothache is not a popular case in our in our clinic. Okay. So let's move on number 3. Lesson feature 儿童 that means the earache. Again, during my private practice here, I never find any patient suffer from the earache, and then this is the main complaint. Never. Okay, so this is just for your, that's for your reference for that. Okay, what is the cause of the otagia? That means what's the cause of the ear pain? And then ear pain always because of what? Always because exterior syndrome. You know why? Because there's a very special structure inside your body, which is called pharynx. You guys know it? Yeah. Okay. We got a very special structure called the pharynx. E-H-A-R. You know what is it? It's near the throat. Actually, pharynx is not an organ. It's a passage, just like a crossroad. You know why? Because when you are standing in the pharynx, what can you see? When you look down, you can see the esophagus going into the stomach. When you look down, you can see the trachea, which go to the lung. Okay, stomach or the lung. When you go up, you see the nose. Okay, and also this is the nose, this is the mouth. When you see both sides, you can see eustachian tube, which leading to the ear. Okay, so that's why I say this case 儿童, this one. Yeah. This one, why you get the ear pain? Because whenever you get exterior syndrome, and then they are pathogen around this area, will affect your lung, also affect your nose, and when this place get inflammation, okay, or get anything wrong, it will lead to the inflammation of the ear. So many times when people suffer from exterior syndrome, they suffer from also middle ear inflammation, right? That means inflammation will cause the ear pain. So most of the time when you get ear pain because of ear aches because of the exterior syndrome, those are because of the get the sore throat. The sore throat will lead to the ear pain too. Okay, and sometimes the ear pain always because of the tinnitus. Sometimes you got you can't hear anything. However, you get pain too. This is because of real heat. Okay, so there are two causes. One, exterior syndrome, which causes you the ear pain. The other thing is a prolonged disease. Prolonged disease is mostly because of the kidney. As you guys know, kidney opens to ear, right? And the other thing is because of the spin deficiency, because of the lack of nutrient and that. or because stagnated blood, okay? And this lever will, block the listening passage, so you cannot hear and make you deafness or causing deafness or tinnitus out there, okay? And sometimes because of the gallbladder fire about these two sides, okay? Okay, let's see what are the causes for that, okay? And one causes, we got the primary otagia, and this is some pain caused by the exterior or interior problem, and we can divide them into 4 types. One is in the outer side, okay? This is plan. We call it the ear pin, and the other is in the channel, external auditory channel, and some people in the tinnitus, and tinnitus, some is in the middle ear. Okay. I'm not sure how many people have taken the biology course. I think your course in autonomy. Okay. This is your ear. Okay. We got a pinna, and this is your external auditory channel. And here you got a tympanum. And tympanum here you got 3 bones. Okay, those 3 bones. Other 3 bones you get the nerve, the auditory nerve. Why you can hear? Why you can hear me? Because I will send the signal here, right? And then the pinna collects the sound, and then the external auditory channel, and then the sound will strike on this tympanum. The tympanum will strike on these 3 bones. Okay. Staples and also others, and these 3 bones will strike on the auditory nerve, and then you can hear, right? So any part of this one missing, you can't hear. One, you break your tympanum because of swimming, diving, and then this is the problem. Second, these 3 bones will get aging. Okay, once this 3 bone lost its function, you can't hear. You must go to do the operation and remove some artificial bone inside the body, right? So get through this one. So any part of this one get information, you can hear. Okay, sometimes you hear all the rest here, the distribution here. Sometimes you put this one. Okay, this is we got one is in the pinna. Second is in the external auditory canal, and the 3 will be in the tympanum. The 4th one will be in the bones. The 3 in the middle bone. Okay, of course there will be another channel. Okay, last time when I was examination, he asked me which organ in the ear is for balancing. Here, this is what we call the choking. Okay, this is for balancing. Okay, and then the nerve inside. Okay, this is additional formula information for you. Okay, we divided the ear pain into several types. One, we call it the nervous otagia. What does that mean? This is not common in our clinic because this kind of ear pain is very short. Okay. Get the feeling of just a burning feeling. This feeling just shocking. Okay, and this is because of what? Because of the caused by the trigeminal nerve. You know trigeminal nerve here. It is very important. It will cause the paralysis here and sometimes it cause the ear, and usually it causes the paralysis in the face. In this case, we have to add some acupuncture in the face to solve the problem of face paralysis, okay? And always it will affect the tympanic and the phalangeal too, okay? The other thing is, the other cause you got to be reflective otagia. And this one is not because of the ear, but because other reason. Just like when you get, the problem in your mouth, just like the teeth problem, the oral cavity problem, okay? Sometimes because of the nose. The nose problem also affects the ear. Okay, sometimes because of the thorax, as I mentioned before, just like the tonsillitis, and also sometimes because of the trachea and the lung. So actually, ear pain can be caused by problems like mouth, nose, thorax, even the lung. Okay, can cause the problem in the ear. Okay, and what are the diagnosis? As I mentioned before, diagnosis is very important. How do you know that the ear pain is caused by which organ? Okay, first of all, if you open your mouth and then you can see, and you move your ear, and then you get pain, that means this is something problem with the external, okay, you can see it. But if you move your ear, you find the inside is pain, that means maybe the problem in this middle ear, okay, in the ordinary canal here. And this, sometimes the pain will caused by the fever. The fever will cause the ear get inflammation. However, this time the fever, the temperature will not be high, okay? And some people will get inflammation inside. Of course, you detect to see the lab test, okay? And then the bacteria will go around here if you do not keep it clean. Okay? Some people would like to put a needle inside to clean it. Sometimes it will hurt the middle ear and then get inflammation. Okay, those are the points for them to consider. So you can see that those names are not important. The thing is, you have to get the treatment for that. Okay, and the other thing is the chronic inflammation of the external canal. This is also not too much. It's because, as I mentioned before, you're using some object to scratch the ear and causing some of them become, inflammation, or sometimes become, get a thick secretion for that. Okay, so cause it bleeding, and after bleeding, it will cause infections in that part. Okay. Yeah, this is the most important part, differentiation syndrome. As I mentioned before, this ear pain can be caused by exterior syndrome or internally by the liver and bladder heat. The third reason is because of deficiency, yin deficiency, causing reason the fire. Okay, so what are we going to do? You guys have to note, whenever we have this kind of syndrome, we must do it, solve it one by one. For example, if we get exterior syndrome, of course we need to expel the wind, right? Expel the wind. Second, if you get the liver fire and gallbladder fire, of course you subdue the fire or to create the heat. And last one, if you got the yin deficiency, of course you can nourish the yin and also subdue the fire. Okay. And here, how can we divide one by one? Identify one by one. The solution is we see how urgent is the time, whether it's the acute or it is in the chronic disease. Okay. For example, when it's a chronic disease, we had to get rid of the liver and the gallbladder fire. So it will happen in the initial stage of the exterior syndrome. So what we can do is to dispel the wind. Okay. For the long-term disease, what we're going to do? Of course, long-term we need to nourish the yin and also clean the heat. This is the main treatment for that. Okay. Okay. Case one. If the ear pain is caused by the exterior syndrome of wind and heat, never wind cold, I tell you. Never must be wind heat. Because wind heat, we got the heat. And then you can see the pinna and external auditory canal will appear red in color. You yourself will feel heat sensation. You yourself will have a shiver and also fever together. Okay, in this case, especially in your pulse, you can see floating and also rapid. And then when you examine, you can find all this area get swollen, the ear, okay? And sometimes you get some secretion. As I mentioned before, anytime your body get inflammation, you will see secretion, right? Nose, you can now discharge. Ear, you can see ear secretion. And the mouth, you can see the phlegm, okay? And all those, you can see the secretion. And this secretion is also yellow in color, not white in color. Also, it is either fluid, a sticky fluid, or liquid in that form, right? So whatever the pulse will be rapid. And how can you deal with that? As I mentioned before, dispelling wind and clearing heat. The most important formula is Yan Qiao San. Yan Qiao San, which you can buy even in TNT or even in Chinese herbal shop in the form of a Chinese patent medicine. It's very good to keep one bottle at home. Okay, this is very useful for exterior, expelling the wind or to cure the sore throat. This is Yan Qiao San. Okay, I'm not talking about the modification now. And about secondly, internally, if the ear pain is caused by the gallbladder and also the liver heat, and then you can see what? You can see your ear is red and swollen and severe pain. Okay, this is characteristic. Sometimes it will have some fluid flowing out from there, and then you have experience a fever and irritability, drinking, and then sometimes you get constipation, and the red tongue with yellow coat, and the pulse is wiry. As I mentioned, wiry. You see wiry? There's two functions. One, because of liver disease, liver problem. Second, sometimes because this accumulation or some, stagnation inside the body. You also get wiry. And rapid. It means what? Rapid means heat. So heat in the liver is a characteristic of this type of ear pain. So what do you do? Yeah, we bring another. Again, we bring another formula, which is called 龍膽瀉肝湯. 龍膽瀉肝湯. 龍膽 is one kind of herb. We call it 龍膽草. It's releasing the liver heat. 瀉肝 means what? Means purging the liver. So the whole formula means 龍膽 purging liver soup. This means for the purging the heat in the liver. Okay. And the third type we call it the yin deficiency. Okay. If the ear pain is caused by yin deficiency, what we are going to do? And then we have to nurse the yin. Here you can see the patient suffer from the itching, because it's not heat, right? Itching sometimes caused by wind. If somebody complains to you, I get an itching ear, and then you can just consider whether it's yin deficiency, because the itching is due to dryness. Dryness is because of what? Yin deficiency, not enough body fluid. Okay, so we cut a little bit secretion, and then you can get the hair, the skin outside the ear will very thick and also thicken, and also we can see some scars, some scar outside and some scale. And this time you see the tongue is red and also thin, and also the pulse will be fine and rapid. When I was studying auricular acupuncture, I not only learned the different area, right, of that, I also learned the external feature of the ear. Okay, whenever there you get a scar or somewhere when the abnormal growth of the skin, they miss that position. They have something wrong with that. So this is the same as we do the observation. Okay, if you find something wrong with the place where equivalent or correspond to your part, just like this is the heart, this is the lung, and this is the bladder, you just subtract whether this is the same or not. So here in this description, you can see according to auricular acupuncture, you can also apply the same theory. Okay, here just as what we can as a wooden secretion, thickened skin, okay, and rough there, and then you can just consider whether this corresponding area get any information, get any problem there. Okay, so here is also another theory. Okay, about the acupuncture, when you get any problem with your ear, just consider the point around your ear. Okay, so what we're going to do is yifeng is here, just below your ear, right? So we call this point to be the TV17. Okay, around the ear, there's a lot of channels, right? Around here, for example, this we got 3 points. This one we got the Erman. This is Tingong, is Tinghuai. Okay, Erman is SJ21. Okay, I'm sorry, SJ we got T. It's TE21. And this Tingong is SI19. And this is Tinghuai. Tinghuai is TE2. You can see the triple warmer, the small intestine, and also the GB. Gallbladder, all the channels around the ears, right? So if you get the ear pain, you just consider all of these channels and also the organs. So here you can see that we got the here we got the yifeng, means yifeng here, and Tinghuai. Okay, Tinghuai is lower. Okay, the GB, and also the Sa Si here is what? Is in the foot. Okay, there are 44 points in the GB, I mean the gallbladder, right? And the last point is in the fourth toe. And just before the fourth toe, in the junction between the fourth and the fifth toe, you can find what we call the Sa Si. Sa Si actually is the water point of the GB. So when you see any problem in your gallbladder, you just consider this point to supply more water. Okay, and we also got another point, 中距. 中距 is here, right? This is 一嘛, this is 中距. 中距 here, right? 中距 is here. Okay, you can go up here. It's 中距, right? So those points we consider to be the principal points. Of course, around the year, there are several points. Okay, so we consider them to match with the problem. And for other supplementary points, you can just add 太冲. 太冲 is the point for the liver. And so LR3. And the other point is 优势. 优势 is GB40. GB40, remember, this is the shoe point, not the shoe point, it's the source point. The source point. Okay. You know, the 修饰 is, the 修饰 is the GB40. GB40 is the source point for the gallbladder. Okay, so you can lower the fire in the gallbladder. Okay, you know the 外观, as I mentioned here, 外观 for any headache, for any toothache, and here for the ear too. So this 外观 govern for any pain in your head, about your head. Okay, either the headache, either your toothache, and your ear problem. Okay, and also 合谷 also govern the face and the mouth, right? And here also govern the ear. So we consider the TE5, the GB20. I'm not sure. This one, please correct. The GN, GB. If you get this page, the GB20. You get Nov.7 and 合谷 here. And if you get any problem with the kidney, you just consider what? You just consider your kidney. BL23. And 格数, as I mentioned before, this point is for tonifying your blood. Okay, so you consider your kidney, your blood, and also your 太息. This is the liver, the kidney. Okay, so kidney and blood together for the yin deficiency. So yin deficiency, you can just add this water point. This is the tonification point, and this is for the blood only. Okay, as I mentioned before this, you can just go over to the ear, right? Ear point here. Consider all the organs. I'm not going to talk about the auricular acupuncture. Other methods. This is easy for the Chinese people. Once they get sick, they will not go to see a practitioner, Chinese medicine practitioner. They just simply go to the Chinese herbal shop and ask the shopkeeper, yeah, I got something wrong with my teeth. And then he just pick up this one, 沙呼茶 for you, and then go home and boil. How many amount? No, they do not care about the amount. They just put a hand and then add the sugar and boil it. You're okay, right? And the other thing, they just consider use 菊花, that means a chrysanthemum. Okay, and also 笨四年 and herb to boil together, and then the ear pain get okay. Right? So this is the experience. So you know that to be a shopkeeper in Chinese herbal shop, we always sometimes should equip it with some kind of simple and proved recipes. Okay. How about external method? You know, when you get inflammation and infectious problem in your ear, you have to got something to wash. Okay. External use, they can pick up some Chinese medicine to boil it and then clean it. Either you can clean with the Western, the infectants, or you can just use in Chinese medicine to boil it, cool it down, and then wash the ear. We do have this kind of the washing material with that. Okay, so you must you can use those external agents to clean your ear. Okay, or so here, what I'm going to do is use the 3% hydrogen peroxide. When you guys get the examination of the safety or the you can also know this 3% hydrogen peroxide, no hydroxide, okay, hydrogen peroxide. Because I'm studying chemistry when I was in university, this to be H2O2 instead. So hydrogen peroxide, not hydrogen dioxide. This is wrong, okay? Okay, you're using hydrogen peroxide or use the 3% 黄连. 黄婆 is a kind of Chinese medicine. You just boil it and then use the water to wash your ear. since Wombo is a kind of a heat curing agent, it can also, clean your ear. Of course, you can buy the Western medicine for that. And if it's itching, you can just apply some ointment in the ear, okay, to use the cotton bud to apply in the ear. And if you get the inflammation or you get the swelling of the ear channel, okay, you can use some powder, okay, a bit of some powder, put in the ear, and then clear. All those are the solution for the, okay, so you can go to Chinese herbal shop to buy some oil, okay, you say 红花油, those can also cure the ear. This is the usual household ointment for us when we are in Hong Kong and China, okay. We get one bottle of that, and that bottle can be many uses. Sometimes you get any time you can just apply it, okay. There are many traditional Chinese drug for us, which is do not cost too much time. You just apply it, accidentally. Okay? Good. This is a second. Can we take another 5 minutes break? Okay, come back and then finish the other two. Yes.
Comment about people that have many earrings in their ears. Because when I do a regular acupuncture, and I always tell people with many earrings that it actually interferes with the chi.
Not really, but the thing is, you make those points fatigue to be sensitive.
Yeah.
Like your case, you get a ring here, but this is equivalent to the eye.
Yeah, I know.
In the eye, right?
Yeah.
If anything wrong with your eye, we cannot apply a point in those points.
Yeah.
Because they are insensitive to that, right?
Yeah.
Instead, you can just another point doing that. So when you get more earring here, that means you make your ear insensitive to some of the points.
Okay.
Right? You decrease the place so that I can apply the needle. That is the only disadvantage.
But do you think that it causes pathology?
No, not really.
You don't think so? Okay.
No.
So,
but it just decrease the number of the points you can apply in the ear.
Okay.
Because those ones can be of no
So you
use.
don't think it affects the organs at all?
No.
Okay.
Then, to the best of my knowledge, I won't.
Okay.
But even if you get that, I think just for the because sometimes the body will adapt to it.
Okay.
Like your ear, you can prolong it, get it there for a long time, you still, have no sensitive to that.
Yeah.
So no cause. I don't think it will cause any problem in the chin. No. But except you get the research for that. Okay. For example, 7,000 people will get this one, and then they get chi deficiency. The other 1,000 do not get. They know I just compare that. But until now, there's no research.
Yeah, that's the problem. There's no.
Yeah, that's right.
Yeah.
And Western people believe in research findings, right?
Yeah,
so if you
yeah.
do that, and then they will be convinced that you don't.
What about the belly button ring? Like when you do CVA is there any research around this? People put like a ring in the belly button.
Yeah, in the back, just outside the belly.
Yeah.
And the outside, I don't think because you got the skin, but inside the problem.
Yeah.
Just people they get the conception, right?
Yeah.
And then they put it in the uterus to stop the conception. I think this is the problem.
So in Chinese medicine, if people have infertility issues, do Chinese doctors recommend they take out?
Yeah. Exactly. We won't do that. Chinese medicine, the first one we object to do any operation. The least we do because every time you do operation, you're breaking of your chi.
Yeah.
Your chi will be broken. Okay.
Yeah.
So after you finish your operation, you come with chi deficiency and blood deficiency. It takes a long time for you to tonify yourself to recover. This is what we suggest.
Yeah.
Okay? Yeah. So you're right. So I think this is what we believe.
Yeah.
Okay? Also the vaccination too. In China, we object the kids to get the vaccination.
To what?
Vaccination.
Oh, vaccination.
Injection. Yeah, this is also against the Chinese medicine theory.
Yeah.
We are not going to put some powder inside our body to induce this kind of
toxic heat.
Exactly. So we are not going to do it. We want the body as natural as possible.
Yeah.
Just the smallpox or just like the measles. Those are natural for the kids to do it. Do not stop it.
Yeah.
So what's the stop it? They will be, reverse to the natural.
Yeah.
Right? So we just let it be.
Yeah.
And we find this is what we call the fetal toxic.
Yeah.
You have to disperse out. So it's natural for you to disperse. Don't stop.
Yeah.
But the Western medicine just put a vaccine and they stop this.
Yeah.
Right? Just like us. Okay?
Okay, thank you.
Yeah. Thank you.
你好，老板，晚上。你好，再见您好。这样，我5个人，1个人我1.15才到。你这个菜做完了，我上面是关掉。行吧，有一个非常这个。所以你看安排1.10分到你给我写菜谱，写好了，到这吃完了，好吧？有一点那个司机特色的，有一点那个好吧？好，一会儿见啊，一会儿见。好，别打断啊。你美门一块就是
Somebody's doing efficient.
Yes, thank you. Still boiling. I asked the car to replace another bottle there.
Yeah, he is.
Good.
你好，那个就是那个是。
Yeah, you're right. 40, yeah. Okay, let's start. Okay, I'm sorry to inform you that, for every page in my slide, there's a few pages in that. Actually, the office is trying to pin out all this one, okay? Same as this one, I just want to show you. Yeah, every time you got in the writing, because the book is not come with the PowerPoint. In PowerPoint, we just add 2 more PowerPoint in that. Just every time we got the name of that, and then we got the summary of this syndrome, we got the point, and then we got all the types with the acupuncture, and then with the prescription, and the acupuncture with description, and so that this one will be added in your book. Okay? So today, afternoon and afternoon, we've got 10 pieces with this one, ranging from the headache and the tooth, and now we got the face pain and all this thing, and then you get attached to your book, okay? And the front page, every chapter before you get this summary. So next time when you attend the examination, you just take this one and then you find all the different differentiation, all the points, and all the description, right? So no need to just put it page by page, right? Understand?
Can we have it now? To the exam?
Yeah, you can bring all the things in the examination. Everything, because they're one book examination.
Okay.
This is one book, right?
Are you going to get the ones for the previous lectures?
Yeah, they're going to make the previous lecture, but for today, just the principle. Think that this one is best to you guys when you get the examination, and when you pick this, just keep it in your book, stick it in there, okay? Just before each chapter, okay, you get this one. This is one example in the 头痛, okay, you just pass it on, okay? This one is 牙痛, you just pass it on. And see, same as this one, okay? So we get the just summary for that. And this afternoon, I know Alex will give you 10 chapters, okay, for this one, okay? So I just want to show you, this is to help the students, okay? So this one in the beginning, I just don't know, I just forgot to tell you this one. And then actually in the beginning pages, just like this one, then you can have all the summary for that, okay? So let's, question.
You have these summaries for the other two books as well?
Yeah, they're just preparing for that. But today you don't have time, we just prepare this book first. But next time we prepare also book 1 and book 2, and also book 4 and book 5, right? And then this is what we are going to prepare for the student. And next time, as I showed you before, on the last session, we are going to prepare some cases on each chapter. I'm going to plan 2 or 3 cases for each chapter for you guys to fill in, and then I'll give the examination, right? This is it.
Thank you so much.
Yeah, you are welcome. Because as a teacher, I always complain to the school that if I don't know the teaching objective, I will not teach it. Okay? The first time when the headmaster told me to teach this course, I said, what are the objectives of them? They are going to take examination, right? So thank you for that, gentlemen. Just remind me. I just asked the principal. The principal said, okay, wait. We are going to prepare some more things for the student. Firstly, we'll prepare this summary for you. And second, we are going to prepare the questions for you, okay? And then we try to prepare about 2 to 3 questions for each chapter. So each chapter, you get 52 chapters, right? So at least we'll have about 150 case studies for you, so that you can prepare them and then bring them to the examination center to do, right? So this is why you guys pay money here, listen to the review, and then get those summary, and then get the exam yourself and get the more exam. This is what I want, okay? You're welcome. Okay, here. Yeah, this is summary you will get in this afternoon. Okay, got the main tone, the face paint, and then we got each kind of the symptom, just like 2, 3, 4, and then each time we got P representing the, A representing for acupuncture, P representing the prescription for herbs. Okay, this is what we are going to do. Okay. Oh yeah, sorry. Yeah. Got. Yeah, this is our time. Okay. Before we have a lunch, we will finish 2 more chapters. One is in the face pain, the other is in the other. Okay. Okay. The face pain always will have a pain in the face. Sometimes it radiates to the eye, sometimes with the ear. But when you have face pain, of course, those are acute, right? And this acute face pain in Chinese people, we call it 面风. Feng, as I mentioned before, in Chinese medicine classic, means something happened suddenly and something moving. Okay, if something happened to me in the face, you can see this is a kind of scorching, radiating, and also spastic pain there. Okay, and usually this face pain seldom found in the kid, some of the young people, and the people like us, over 50, and then we can always see this kind of pain. And however, this is also in the woman. You know why? As I mentioned last time, women has 4 things which men do not have. Which 4? First, menstrual cycle. We don't have, right? Second, the leukorrhea. That means we do not have secretion from our uterus. 4th, we do not have pregnancy. We will not pregnant baby. Kids, men. The 4th one, giving birth to the baby, right? So those 4 things are special for women. And especially the first one, the menstrual cycle. Women will suffer 6 to 7 days losing of heat, losing of blood every month, right? From 13 to 49. So this is why their body will always weaker than men. So they have experienced more disease than men. However, their life will longer than men. This is curious, I don't know. I don't know. Yeah, until I can't find the reason why women have a longer life than men. Maybe men.
They cleanse with the cycle.
Because they get rid of toxins.
Yeah, you can say, they tear the toxin. The other is,
give up.
Yeah, you're right. Yeah. The other thing is, women like express anything they like. Express anything they decide this, but men will just keep this heart deep in our heart, right? And it causes some problem in men, This is a problem. So here I mentioned about women, we have more time to see this kind of face pain, because they sometimes in the trigeminal neuralgia, and then they got some common disease, just like the maxillary ramus and also mandible ramus and those things. Okay, and what are the etiologies? You guys are taking into consideration, but you need not memorize that. You just remember that there because 1, exterior syndrome, 2, internal injury. This is a common formula for any kind of pain, right? Just apply to 1 exterior to interior. Exteriorly, of course, the exopathogen will bring the pathogen inside our body, hindering or stopping or blocking the flow of blood and qi, and causing these channels, and also stopping or blocking there. Second, the stagnation we also called it by what? By the emotional disorder or emotional, disturbance. And this emotional disturbance will bring the heat up, and also the yin deficiency. When yin is deficient, the yang will go up, and this go up become the anti-fire. Okay, and considering the exterior symptom, you know that the wind will bring in the cold to the body. What will the coldness form? When coldness stay in one region, it will make everything constrained, right? Including the blood capillary, including the collateral. That means when it constrain, the blood and qi cannot flow through. In this case, we can't call it stagnation. The blood and qi cannot go. In case it's not cold, heat. What does that mean? Heat that also causes the harm to the body, because the heat will also burn up the thing, and also cause some toxic. And this toxic also will block the flow of the qi and blood. And the third reason, because we call it non-interior, non-exterior reason, we call those one of them to trauma, external trauma, like somebody hit on you, somewhere you're falling down from the height, and then will cause the injury in your body. When you break your bone, the fracture, or you twist your ankle, and also will cause the soft tissue and also the blood capillary there blocked together, right? Like your face, when you hit by somebody, you get bruise here and here. It's also the cause of the pain. And according to Chinese medicine, blockage bring pains. If you remove the blockage, there's no pain there, right? This blockage may cause it by blood, may cause it by wind, may cause it by stagnation, other things, right? Okay, how can we carry on the differentiation syndrome? That means, how do you know that the patient suffer from the face pain? It's easy, because the patient will tell you in his chief complaint that he got the pain just like cutting, stabbing, or scorching pain in his face, okay? And this also affects the muscle. And sometimes this pain will associate with the redness in the face, okay? Or sometimes the face is so pain that he cannot control his saliva flowing out here, right? Some people getting stroke. You get deviated face, and then you cannot talk. When you talk, the saliva will flow out, right? And he cannot. And even when he's brushing his teeth, he cannot. He find all the water of saliva flowing out here. You cannot control. Just like the time when you're doing go to the dentist and take your teeth off, okay? The local, meaning your mouth, you cannot control your mouth. The same thing, right? And those are the cause of that, right? And this pain sometimes will be long, sometimes will be short, okay? And depending on what kind of disease is that. And we consider different reasons. The first cause is because exterior syndrome. If people suffer from exterior syndrome, the wind cold cause the face pain. In this case, we found that he feel pain first, and we put the hot pad here, or we put the hand here, and then you feel comfortable. In this case, you know that this guy must be suffer from coldness, okay? And in addition to that, you find the guy has a running nose. Remember, the nasal discharge must be clear and also long and also white in this case, because coldness. During the coldness syndrome, you can see the nasal discharge should be clear and also white. And also the tongue condition will be white. The pulse should be floating and tight. As I mentioned at the beginning of today, this morning, I said that anytime you experience the floating pulse, it means the exterior syndrome. We get a tight pulse, either cold or pain. In this time you feel pain, of course the pulse will be tight too. For those people suffering from the exterior heat syndrome, and the sign syndrome will be different. So, he also feel pain, but this thing you can feel a hot feeling, hot sensation. And also, how that the eye sometimes will be red too, congested eye, right? And the tear will flow out. Sometimes the tear will show whether you suffer from exterior cold or heat syndrome. Okay, some people will get the red eye, and then we get the tear is hot. In this case, it's exterior hot syndrome. But some people get the tear automatically flowing out without any feeling. And right before is no feeling. This is because of coldness, because of deficiency. Okay, some people getting aging, the eye aging, the tear will also flow out easily without any feeling of that. Okay, those are the method to distinguish whether this is because of excess or deficiency. Okay, when you see those people suffer from heat exterior, and you see their tongue, you can see the tongue is yellow. Okay, tongue coat is yellow. The tongue may be red, but the pulse is really obvious, should be rapid, because rapid pulse means heat. Okay, and some people getting face pain because of the liver and also the stomach heat. In this case, when people suffer from liver heat, there's a very distinct sign and symptom. It's always irritable, easily get angry. Okay, irritable and easily get angry, and also irritable. And these people, you cannot touch him, otherwise he will beat you or he will be angry at that time. And in addition, he will always thirsty and get the constipation. Those we got the real heat, or we got the full heat, or the tongue red, cold, yellow, and the pulse rapid too. And the fourth type of the face pain is because of the yin deficiency. Yin deficiency causes the folding of yang. In this way, you will find characteristic is the red cheek. What's the red cheek? I saw many people who had the red cheek here with a white face, and especially in the time from 2 o'clock to 4 o'clock in the afternoon, the cheek is really red. Sometimes you feel it, sometimes you will not feel it, but the people, his neighbor or his husband, his wife will inform me, okay, you get a red cheek in this afternoon. Okay, this is what? This is the symptom of the yin deficiency. We got this red cheek to be sometimes to be tidal fever, or what we call the Malar fever, M-A-L-A-R, Malar fever. That means the heat only appear in the afternoon from 2 to 4 o'clock at that time. Okay, and this pulse is very characteristic. When people suffer from yin deficiency, should have rapid and fine pulse. Okay, but the pulse is forceless, never forceful. If it's forceful, that means it's a full heat. Okay, and the fifth type of face pain is caused by qi and blood stagnation. Okay, and these people either, if a woman, she may experience one exterior symptom while she was in period. That means if a woman is in the menstrual cycle, she at the same time caught cold, and this cold will enter into his menstruation, enter into his uterus and stay there, and then become heat, become the stagnated blood. This is the usual case of women. For men, if you are fighting with other people, or if you are falling from the height, and then you get the bruise, and then you get the stagnated blood, the stagnated blood stay there. Those are the cause of the stagnated blood in the man, right? If this stagnated blood do not go away, stay in the body, you know what is the result? The result will get the general pain, and sometimes you get the joints cannot move freely in the morning. Okay, those pains are fixed, and some pains will get intensified when the weather changes. Okay, and how do you know this stagnated blood? One, you can see the tongue. The tongue will get the blue color or the blue stain on the tongue. Okay. The other you can see the as I mentioned this morning, sublingual wing under your tongue will get thicker and also get blue in color. And your pulse is very characterized by your stagnated blood. Your pulse will be choppy. What do you mean by choppy? Choppy, that means you take up a bamboo and use a knife to chop it. Okay, when you chop the bamboo, you will experience difficulty in that. This is choppy. Or while you're walking in the swimming pool, you're walking, you start to run in the swimming pool, you experience difficulty. And those two analogies will be the same as what we feel in the choppy pulse. The choppy pulse means what? Choppy pulse means stagnation, stagnated blood inside our body. Okay. So how about the causes? The causes here is because experience. Yeah. So explain. Yeah, this is the differentiation of the 5 types of the face pain. And then according to the channels and collateral, we will find that our eye pain is because of the foot taiyang. That means this is because of the urinary bladder. You know what's the point here? We call it Jingming, right? This is the BL1. Here we get Jiangzhu is BL2. Okay, so all around here until the bladder here is all because of the foot taiyang urinary bladder channel. Okay, and how about the jaws, upper jaw and lower jaw? Those are because of the foot and hand yang ming. Okay, and same as the stomach and also the large intestine. Okay, so anything concerned about the face, usually, you know, the face contains the taiyang, yang ming, and also sometimes the SI, the small intestine. Okay, and also the HJ, some two points about the small intestine in the face, and 2 points about the large intestine. Okay, one is the Yingxiang, the other is the Womiao, around there. So it's nothing concerned about, it's mainly 2 things concerned about large intestine and also the small intestine there. Okay. How about the treatment? When you guys are using the needle in the face, of course, for the face in many points. Okay. So here the principal point suggests Jiangzhu is here. Okay. The tip of this is the Jiangzhu BL2, as I mentioned before. And the other thing about stomach is Siba. This one is Qingyi, and this is Siba. Okay. Siba is here, right? And then we got the Shaoguan. So many points are concerned about stomach. As I mentioned before, remember this point. Okay, ST1, Qingyi, ST2, Siba, ST4, Dichang, ST6, this is Jiaqie, ST7, Shaoguan, ST8 here, we got the Taowei. All those things around the face, okay? The other thing you got to remember is the back. If you got just half the face paralyzed, besides the face, you consider also this the 风池. That means the GB, the GB20, and some people consider the 遗风, that means the SJ17 here too, right? So those points you have to consider. And the other on the hand, again, 合谷, LI4 is very important for any pain in the face, in the mouth, okay, in the teeth. We can also make use of the Heku. This upon for stopping the pain. Okay, how about the supplementary points? Supplementary points, of course, you know the face. Besides, we got the Jiangzhu. Out behind the eye, you get a lot of points, right? Here we got the Xizhukong, Tongji Miao. Xizhukong here is what we call it the ST23, and also got Tongji Miao. Tongji Miao is just here, okay? And Yuji is in the middle, the special point for the elbow. But I just mentioned, if you get any problem in the eye, you can just make a round here, okay? Those points are very useful. For example, you get the congested eye, you get eye inflammation. Of course, we consider this one. The Jiangzhu and also the Yuji. One point about that, Yanba is GB14. GB14, you usually use a needle from Yanba down until to the middle here. It's called the Jiangzhu, from Yanba to Jiangzhu. Yanba is GB14, and then we use a needle from GB14 down to here, to Yuji. Yuji is special point, which we call the EX. form. Yeah, this is also for curing any eye disease over here. And the other one is the LI20, this point, Yingxiang. Yingxiang is for what? For you have a running nose. If a long running nose, you want to stop it, just put 2 needles here, just like the antenna of the cat, okay? And then the other one is here, 耐Yingxiang. So for me, I usually use 4 needles. 1, 2, 3, 4 here to stop the running nose for the people. Okay, for those people suffer from sinus. Okay, the nose sinus. We always ask people to use the finger and then just replace this point and also this point. And I got 2 teachers. One teacher told me that the Yuji, the Yingxian is this point. The other teacher told me that Yuji is this point. Actually, both points can work. Yeah. Here, if you're for those pure substance sinus, you just press it here. When you press it, you get paralyzed, and this is also good for you to to tonify your nose whenever you get a nose. So both this point and this point can work. Okay, and this is also in your face. The other one is 全尿. 全尿 is SI 18. Okay, this size 17. 余风 this size 18. 18 is for what? For your cheek, down your cheek here, right? And those are very important. Okay, now for addition. Draw addition. If you put the wrinkle, as I mentioned before, you add one more point to be BL10. No, 风文 BL12, yeah, right. BL12 is getting rid of the wind. Okay, and also when you get the wrinkle, this is a metal, the lung, right? So consider lung 7. Lung 7, 铝缺. Lecture is for coughing, also for expelling the exterior syndrome. Okay, those are the points for the exterior syndrome. However, if you have exterior heat instead of exterior cold, of course you include all the exterior cold point in addition to LI11. Okay, LI11, this exterior for the point, and also sometimes the LU5. These 2 points are the 2 points for the one for the lung, the other for large intestine. Okay, remember, even the point large intestine can help in expelling the exterior syndrome, expelling heat. So these 2 points are for heat. Okay, LU5 and LI11. Understand? Of course, he missed 1 point. Which point? You know, the back. Yeah, the 大椎. You are right. The back. The GV14. As I told you this morning, whenever your exterior syndrome, remember 大椎, GV14 and 合谷. Okay, 合谷. LI4, and also the other point is the LU7. So remember, LU7, LI4, and GV14. Those are the points basically for exterior syndrome. Okay, if you're more cold, of course you will get BL12. More heat, you will get LI11 and also LU5. Understand? Those are general formula. I'll repeat this again. Pardon me? Okay, I'll write down. I don't have time there. But every time I will repeat that, okay? I just write first. Wait a little bit. Okay. For general exterior syndrome, we are going to consider the GV, okay, the GV14, and also LI4, and L, the other point is we are going to have LU7. Those are for the general exterior syndrome. If you get more cold, consider the BL14. No, the BL12 is for the cold. Okay. If you get heat, what we're going to do? Of course, we consider the LI11, and also we get more heat and consider LU5. Okay. This is heat, and this is more cold. Understand? Yeah. Okay, that's good. So you're welcome. Okay. I'll repeat next time. Okay, no problem. And then here you also mentioned about if they got the hidden heat inside the liver and stomach, and then we're going to first of all deal with the lung. So deal with the stomach. If you get heat in the stomach, of course we add more water to that, which is the water point of the stomach, which is 19. Okay, ST44. Okay. Since this is because of the liver and stomach we get ST44, but liver, of course, everybody knows this is LI3. That means the liver free. We call it 太冲. Okay, and for yin deficiency, of course, we need 太冲. That means liver free. Besides that, the liver yin is caused by the kidney, so we consider the water pump of the kidney. And then Tai Chi Ki3 is both for tonification of liver yin and liver yang. I repeat once again. Ki3 is both tonify liver yin and liver yang. We are going to use at this point. So in case of kidney yin deficiency, we are dealing with this point. I mean the Tai Chi. Okay, liver yang, of course, Tai Chi too. The water point, of course, you get a Ki7 with a Fu Liu and Ki6 for the kidney yang deficiency. Okay, and last of that, we are talking about the stagnation of qi and blood. When you have qi and blood stagnation, what are we going to do? We're going to move the qi and activate the blood, right? What point we are going to move the qi? RAN 17, right? This is qi accumulated here. This is RAN 17. RAN 17, besides stop coughing, we also can disperse the qi. Okay, and how can we activate the blood? Of course, you can activate the blood by depending on SP10. SP10. Okay, this is the share height. That means the blood for the C for the blood. And also the best shoe. There's an important point for 25 the blood, which is BL17. 格数. Okay. The reason why the author put this 三阴交 SP6 here, because 三阴交 is the point where 3 yin channels coincide with each other, right? The 3 yin, that means the liver, the spleen, and also the which one? Liver, spleen, and kidney. Yeah, the 3 yin channel will coincide at this point. So we pin this one in order to circulate. Okay, make the channels in this 3 form circulate. Yeah, well, okay. Here you mentioned why we use Yanzhu, I mean BL2, Xiba, ST2, Shaguan, ST7, and Dichang, ST4, Sache, ST6. Why we use this? Because they're all in the face. Okay? And why we use Hegu? Because according to the Chinese medicine saying that any disorder in face and mouth, we can deal with the Hegu, Li4. This is a very important statement. Any people learning Chinese medicine acupuncture in Hong Kong, in China, they must remember this one. Any disorder in the mouth and face must be dealt with by Hegu, Li4. Okay, this is very important. And the other thing you mentioned about why Tai Chong, that means L3, RR3 is used, because this is stopping the pain, and also it will, release the muscular spasm. I mean, some muscular spasm can be released by needling your Tai Chong. Okay, Feng Qi, as its name, means believe in the wind, right? So you can stop pain too. Okay, here I'm not going to mention about the auricular, because the shortage of time. We are not going to mention about the ear and the auricular acupuncture. And also, as I mentioned before, you use the dermal needle. For those things in the face is easy, because for those people who are afraid being used a needle, you can use the dermal needle to stimulate, or also the stop pain there, right? Remark. In Western medicine, we consider the disease whether trigeminal nephrasia. Okay, this is a very important disease in Western medicine, and then they will use all type of painkiller to deal with that. But in Chinese medicine, we prove that acupuncture is a definitely have a definite effect on that. Okay, and then we can use acupuncture to treat it. And using the method, you can just you guys need not write down any method, just like staying the needle for retainer how long, or how the dosage of that. We are not going to deal with that. Okay, and you guys just take those lifestyle advice as your information. Okay, and those can be useful when you guys doing your private practice in your clinic. You can just use this advice for your patients. Okay, and about the Chinese medicine herbal prescription, for any time of the face pain, I mean caused by the exterior cold syndrome, we are using the 川芎茶条散, 川芎茶条散. Okay, and also for the stomach, of course we use the 清微散, but the 清微散 is just for what? We have to modify that because we need more thing to deal with the fire in the stomach. And for the liver, it's a very important 清肝散. What about 清肝散? 清 means clear, 肝 means liver. That means a clear liver pill. Okay, and the fourth one we are going to use another formula called 邪符煮雨汤. 绝夫主义汤 is to clear away the phlegm stagnation in the cholesterol. Okay, this is what we have. Okay, this is the last part of the face pain. Okay, see any questions? I just give you 1 minute time to do it. Okay. Okay, this is very common in the clinic. We are talking about the gastric disorder, and this time we are going to talk about epigastric pain. Epigastric pain. Okay. Yeah. People living in Toronto or just like the big cities like Toronto and Hong Kong always suffer from those kind of stomach. And this stomach, in Chinese medicine, we always call it epigastric pain, or just a gastralgia for that. Okay, those are the pages summarized for those symptoms and also the principal points and also the Chinese herbs for that. Okay, and here. We just want to tell you that this is the pain happen in the stomach. Where is it? This is between the nerve and also the bone here. That means between the RAN 8 and also RAN 15 in this part. Because our stomach is lies on the left part here. And the right part, of course, will affect it because the pain will radiate in the right. So any pain here, we call it the liver pain. Anything here, we call it the liver stomach pain. Because it's the stomach here. Okay, it's just the liver. However, the liver 5 loops. 3 loops here and 2 loops is covering on the stomach. Okay, so the liver pain can be both sides, but stomach pain is just one side here. Understand? And here we just mentioned about the pain will appear in the epigastric position, epigastrium. And in Chinese medicine, since we don't know where is the stomach, so we always mention that this is about the heart pain, the cardiac pain. Actually, like here, right? Many people get pain here. They just mention whether it's because of the stomach or the heart, right? Because they share the same position. Here in the stomach too. Sometimes people subtract the heart here. Actually, the heart is above there. But you know, the people in the ancient time, they do not have the idea of where the heart or the stomach is. Just that it's a heart too, right? Any question? Good. Okay. Yeah, that's good. Good. Okay. So in China, in Western medicine, we call those peptic ulcer and peptic neurosis, and also the prolapsed, gastric mucosa to this stroke. We call it the epigastric pain. Yeah. Okay. So when we deal with the etiology, we can find that the stomach ache, or what we call it the epigastric pain, is due to the coldness staying in the stomach. And this coldness stay there will stop or will block the moving of the qi, ascending or descending qi. Okay? And this is one of the reasons. This is because of the coldness. Second is because you people have an eating disorder. Okay, you either eat too much or too little. And you eat too much, it will get the food stagnation, and then the qi cannot move, you get the pain. The other, if you eat too little, of course, your stomach do not have enough energy for moving the food. Okay, and the third reason is because the emotional disorder. Okay, and this emotion we get what we call it is liver qi stagnation. As in liver qi, sometimes it will cause problem here, and sometimes the liver will also cause the problem where? In the stomach, because of the theory of the wood interacting with the earth. Okay, and the other thing is when the qi stagnation long time, it will become what? Become blood stagnation. This is why we have to concern about why we have to deal with qi stagnation as soon as possible, because the qi will become the blood stagnation. And this blood stagnation later on, as I mentioned before, will develop in the tissue stagnation, which is the preliminary stage of some, malignant or tumor or even the cancer cell there. Okay. And the last reason may be due to what? Due to the lung, due to the spleen and stomach deficiency. And spleen deficiency cannot, in case of spleen deficiency, the food cannot be digested and the food stay in your spleen, become dampness. When the stomach deficiency appears, that means the stomach yin is not enough to digest the food. So the food always stay there as a dampness. So either stomach deficiency or spleen deficiency will cause a dampness inside your stomach and also your spleen, causing what we call the epigastric pain there. Okay, now we move to the differentiation of symptoms. How do we know that a patient get epigastric pain? Okay, one, he will tell you so. Two, when he enter into a clinic, he always put in this position. So when I was teaching the diagnosis class, I just advise a student that if anytime you see you consult a Chinese medicine practitioner, don't think that you just do things. Many people told me that you just observe your tongue, you just take your pulse. This is wrong. This is wrong. Once you step into your clinic, you just observe his walking, observe his body shape, observe if you're possible. When he come in this way, and then you know this is suffer from stomach, right? So you need not tell you anything, just see from his posture. So this one, one he will tell you, the other he will tell you that the stomach will get the acute or the severe pain there. And then the other thing is the pain, whether it's light pressing or unlight pressing. Okay, you press it, you will it's comfortable. That means it's because of deficiency. When you press it, you just push it away, and then it does not like any touching. That means excess. Okay, yeah. So deficiency excess can be distinguished whether by light touching or unlike touching. Okay, and also if you get any disturbance in the stomach or get any pain in the stomach, usually you will distinguish by whether it is after meal or before meal. Okay, and then if after meal it get more painful, that means it gets stagnation. Okay, it's before meal it get the pain, that means due to the deficiency. Okay, those are important for that.
Sorry, could you just repeat that again?
Okay, I said sometimes you distinguish whether the pain is due to deficiency or excess. Okay, if the pain intensifies after the meal, that means this is the excess. If then before the meal, after they take the meal, it's okay, or you relieve, that means the deficiency. Okay, and just distinguish by these differences. Okay, first of all, let's consider the stomach pain because of the pathogenic cold. Okay, and if it is due to pathogenic cold, of course, anytime you touch the hot thing, the patient will be easy, will be comfortable, right? So we can say alleviate by the warm pad in this thing. And of course, if people suffer from pathogenic cold, both his pulse and tongue will exhibit the cold symptom, just like the white tongue cold, just like the wiry and the tight pulse in that case. When the tight pulse, that means cold or pain, and then we have the wiry pulse, that means this is because of the liver or stagnation. In this case, the wiry pulse do not mean the liver problem, but it means the stagnation. Okay, and the second reason we say that if due to the food stagnation, and then the patient will get the full and distension in his epigastric position. And also, we can say always sometimes you get vomiting. And the vomit, the thing with a very smelly, just you get a fatty odor or just the throat smell. That means because of the heat. And these people after vomiting will get relieved, will get easy. That means you get food stagnation. Okay, and how about stool? The stool always get wet, and then his pulse always will get, the slippery, and his tongue will get greasy and also thick. Our tongue coat always cover 1/3 of our tongue. If it's more than that, that means you get exterior syndrome. Our tongue coat is thin, it's thick, that means you get stagnation. With thick, with some moisture, with some greasy, that means a very important stagnation, a very severe stagnation in his body. Okay, and if those gastric pain is because of the liver qi, of course, you can see this guy will get the distension on this hypochondrial region. You know why? Because the liver governs the hypochondrial region here. Anytime you get the distension or fullness here, you can just attribute it to the liver problem. Okay, and this guy always sigh because you get stuck, get any oppression in the chest. Once he sigh, he will feel easy. He will feel better. Okay, this is because of the stagnation of the qi or qi stagnation in his liver. Okay, and also, what is the onset of this kind of gastric pain? This always because of the emotional disturbance. He will get this pain. Okay, so the pulse will exhibit wiry. This wiry surely means the liver, not only the stagnation. The pulse is so wiry while the tongue cannot show anything. Okay, why? Because if you get liver hit, you will get both sides red. But if you get liver qi stagnation, you can't see anything. You just see the white and thin. You get thin and white coat. White means cold, but here it doesn't mean cold because there's no cold here. So I can mention that. All what I can tell you is the tongue condition will be the same as those people as normal. However, the disorder can only be found in the pulse. Okay. And the last type of the epigastric pain is because of the qi and blood stagnation. As I mentioned, the qi and blood stagnation will have some signal in his pulse and also in the tongue. The pulse will have a choppy pulse, while the tongue will have some purplish stain on there. And also you can see some thickened ring under his tongue, which we call it the sublingual hypoglossal ring there. Okay, and these people, when suffer from the epigastric pain due to the qi and blood stagnation, will also have a stomach ache there, and the pain is fixed, will not go away. And after to take the food, and then after to finish the meal, the stagnation will be much more serious in that case. So you can see this is because of the stagnation. Okay, stagnation is due to because the qi and blood cannot move. When you take more food, or for the qi and blood cannot move, it make the case more worse in this case. Okay, and besides excess case, they are also due to the deficiency case. And deficiency case, as I mentioned before, like people pressing. You press it, it will feel easy and better. Okay, but the pain is such kind of dull pain. Dull pain, that means the pain a little bit. Okay, but it will keep on. And this dull pain also will is intensified when you get empty stomach. That means before meal, the pain is much more intensified. Okay, after meal, that's okay, right? And this is because what? Because of the stomach and also the spleen deficiency. And this deficiency also comes with the coldness. So coldness is deficiency is the main cause of that. When these people suffer from epigastric pain, you will have the feeling that the saliva will flow out immediately from his stomach up to his mouth. Okay, this is also the symbol, the characteristic for those people who suffer from spleen deficiency. Okay, when you wake up in the morning, we have this kind of feeling of saliva flowing out from your stomach to your mouth. This is also a sign for spleen deficiency. Okay, and these people also have a symptom of diarrhea. And this diarrhea, of course, means deficiency, and you also got restlessness. What do you mean by restlessness? That means less spirit. You're not going to move. And the hand and foot got cold, sometimes freezing cold, when the kidney yang deficiency is also involved. And this is only due to the kidney yin, or only due to the spleen yang deficiency. But when the spleen yang develop to kidney yang, his hand will get freezing cold, okay, and his leg will never get warm. until 2 or 3 hours after they sleep, okay? And this is the symbol for that. And also we found these people will get the pale tongue with thin coating. And the pulse will be weak and also slow. Slow pulse means cold. Okay, weak pulse means deficiency. This is one of the reasons. Okay, the other cause may be caused by the stomach yin. The stomach yin insufficiency will cause the stomach heat raise, and the stomach will get the pain with the heat sensation because there's not enough water. Okay, just as you fry a fish or you fry a meat in your hot pan, if there's not enough oil, and then the fish will get fried, get burned. In this case, your stomach get the same thing. When your stomach do not have enough water, it will just like drying and also frying, and then you get this pain. And this thing, you will be hungry, but you're not willing to eat because you're not that hungry, but your sense of fire in your stomach is keep on burning. It wants more food, but once you take more food, it will digest easily. Okay, it will not absorption. That's digestion. They burn all the food away. And of course, if you get the stomach fire, you will get dry throat and also the dry mouth. Of course, also the constipation caused. And the tongue will be notified by the red tongue and also dry. Remember, dry tongue because you get the little water food in your stomach. Okay, the pulse will be wiry and fine and rapid. Okay, how can you treat this symptom? Okay, as I mentioned before, anything concerned about stomach, don't forget ST36, which is 举三里. The other thing is directly to your stomach, which is 中脘. Okay, it's RAN 12, or what we call it is CV12. The other thing, 内关 here. Okay, anyhow, I can suggest one more point is 合谷. Also sometimes deal with the stomach. Whenever you do not have needle. Okay, you do not bring a needle with you, and somebody get the stomach, you can just press in the 合谷 to stop the pain there. Okay, actually 内关 is for what? It's for your head, dizziness, and for your vomiting. And then you this one, right? So here, I prefer using the 合谷 than 内关. Of course, you can take 内关 PC6 as a reference. So what I suggest here, 举三里 ST36, 中脘 CV12, and also the LI4 instead of the PC6. I think you can take PC6 as a reference, as I mentioned before. Those are the principal points. However, when you consider the supplementary points, you add more the best shoe, right? The best shoe is very useful. For example, when we consider the weight shoe, that means this is the BL21. This is a very good point for protecting the stomach. Okay, and besides, we get other points just like the 皮书, just like the 肾书 or other thing, 膈书, all those are useful. Okay, so if in case of the epigastric pain caused by the stomach, you can consider the 中脘 and also the other point. This is 梁门. Where is 梁门? 梁门 is just in the 中脘, 2 inch in the lateral side. Some is 中脘, and then 2 inch from the 中脘 here to 梁門. Okay, because those 3 points are also in the stomach. Okay, 梁門, 中脘 and 梁門. Okay, and also if it is caused by the liver, you guys have to consider 太冲 LR3, which you can release the pain from your liver, both your liver and also the stomach. For people suffering from the qi stagnation or blood stagnation, as I mentioned before, you have to move your blood by considering PLAR. However, you can consider one more, which is the SP10, in order to move your blood. Okay, and if you got the deficiency in stomach and the spleen, please consider the qi. When you get qi deficiency, I advise you guys to consider 3 points. One is 关元, okay, the other is qi海, this is RAN 4, RAN 6. The other is your 20. Okay, those 3 points are for us to use for dealing with the Qi deficiency. I'll repeat once again. It's CV4, CV6, and also the DV20. Those points are for people who suffer from the Qi deficiency or even Qi collapse. Of course, one more point you have to consider, which is universal tonification, is ST36. Okay, when you tonify your Qi, don't forget this one. Okay, the best Shu, you also consider the Pi Shu and Wei Shu, them is 20 and 21. BL 20 and 21. Okay, if you do not have insufficient fluid in your stomach, please consider more water point. The water point, the general water point is Sanjinjiao, which is SP6, general water point. Specific water point for the stomach, which is ST44, ST44 90. Okay, you can see all these points around here. Why do we make use of those points? Because I mentioned some of them are best Shu, some of them are fun Shu. You know fun Shu? Yeah, this is the fun move point for the stomach is the 中脘. Okay, while the 南门 the tin Shu is for the 大肠 or for the large intestine. So we consider if you have any problem with large intestine, we'll consider the fun move point. This is the ST25. Any problem with stomach, we consider fun move on the stomach, which is the 中脘. That means the CV, the CV 12. Okay. And other points for treatment. Okay, you can consider the ear, the auricular acupuncture. You can also consider electro acupuncture. Some people like to use electro point to get the point on the needle on the ST36. And one point we call the Shenjishu is ST37. But this is for what? For the large intestine. Because according to Chinese medicine theory, and this point ST37 governs the large intestine. So anytime you get constipation, we can just needle the ST37 to stimulate the peristalsis or the large intestine. Okay. So in conclusion, you can know that acupuncture can treat with this epigastric pain, and also the have a feeling of vomiting and also nausea, and then we can just settle down the stomach there. And it also mentioned that the stomach sometimes is caused by the liver and the gallbladder, and also sometimes pancreas. We call that pancreatitis. Okay, and how do we distinguish them? Because we can just look at the history of the patient and also whether he can have other disease, just like a hepatic ulcer, the prolonged disease for that. And for the lifestyle advice, you guys need to know the eating, the regular eating order, regular diet, and also avoid from spicy and also alcohol. Okay. Okay. How about the differentiation? The differentiation symptom, you can see that most of the time, mostly this epigastric pain is due to the excess syndrome. Okay, and then the syndrome may be caused by the liver, and then just like the exterior syndrome of cold, of the eating disorder, and also stagnation heat inside the stomach, and those are also caused by the emotional disorder or internal injury, we call it. Okay, and sometimes some people get the stomach ache or stomach ulcer, but they get the malnutrition, or what we call it by the erroneous treatment. And this is the example I also shared with my students. In Hong Kong, we get some patient who got the stomach for 1 year, and he went to see the Western medicine doctor, and then gave him all pills, but he cannot cure. But once he visit the Chinese medicine practitioner, he found that his stomach ache is because of the liver interacting. So we just give him something for releasing the liver fire and then settle down, and then his stomach, disease in stomach disappear. And then this is why sometimes we are not going to cure, we're not going to deal with the stomach. In the stomach ache, we deal with the liver. And in this case, we find the the problem is solved. Okay, and besides excess problem, we also got the deficiency problem. And this deficiency problem sometimes makes deficiency and excess both together. Because what? Because we find, for example, spin qi deficiency. This is deficiency, right? However, we also find the liver yang hyperactivity together. So within the same person, we can experience both the spin qi deficiency while the liver yang hyperactivity. So so we say this is both combination of the excess and deficiency together. Okay, for those people having the symptom of the spin yang deficiency, and then they will have the stomach ache, and so also of experiencing something like the qi deficiency. Okay, and how can we do that? Of course, we just raise up the qi. Okay, and also we get away the coldness. And for people suffering with stagnation, of course, we have to resolve the stagnation by giving him more eliminating herbs or reducing the sedation method in the acupuncture. Okay, and if some people suffer from liver qi deficiency, of course, you have to resolve the qi stagnation. Okay, and heat curing. For those people suffer from yin deficiency, of course, we have to nurse the yin. For people suffer from qi collapse, of course, you have to ascend the qi by giving more qi tonification the herbs to him. Okay, and for yang deficiency, of course, we have to tonify the kidney yang, and those are the things we're going to deal with. Okay, now we move to each symptom one by one. One, you can see the stomach qi stagnation. What we're going to do, and this guy will experience all sorts of sudden attack and just the pain, and after warming, and then you get the getting the hot drink, you get all those solved. In this case, you find that both his tongue and stomach will exhibit all those symptoms of the stagnation. Okay, and just as the pulse, floating pulse, and also the tight pulse. So, and this is because the coldness attacking the stomach, causing the yang qi stagnation there. Okay, so therefore, when you get hot subject or hot pad, you will get comfortable. No, and then you still the hot there. Okay, so you can see. I'm not going to repeat the pulse and the tongue condition. What are we going to do? So you guys have to know the treatment principle. If you get cold in your stomach, our treatment principle will be you just warm the middle gel and dispel the wind. When you warm the middle gel and dispel the wind, of course the stomach will resolve its function, and then the pain will disappear. So what we're going to do, we're going to use 凉附丸, okay, or 姜春汤. However, those 姜春汤 are really mild for that. The most important thing is to do the masturbation. Although masturbation in Canada is not popular, but as I always advise students, masturbation has more tonification power than the acupuncture. So your masturbation at the 中脘, 120, and also the 三阴交, or those are better for those patients who suffer from coldness in their stomach. Okay, and of course in Chinese herb you can just add some herbs for tonifying, warming, just like the ginger, just like the garlic, and all those things will be, just like the pepper, those are effective. Okay, if we have a serious symptom, of course we can get some wind dispelling herb, just like the the 葱拔 or others, 几树叶, or those things. Okay, I'm not going to mention too much about the herbs here. Okay, example, we are going to use the 凉附丸, okay, 高良姜 and also 吉香附. The second symptom, we call it the retention of food. You got retention, that means you get fullness, you get distension. Okay, and always this patient, always burping, always purging. Okay, because there's too much food inside. Only way to do is just to purge all the food outside, or we can just eat some eliminating herb so that the food can be digested easily. Okay, if it stays in the stomach, we can just use some eliminating herb. If we stay in the large intestine, of course, we can use purging herb to get it out through the defecation. Okay, and what is the diagnosis? You can see this kind of people always have purging with the fatty odor, and the stomach get full and distension. Okay, and when you eat more food, it will get more discomfortable. Okay, in this case, these people will always get vomiting. After vomiting, you will get relieved. Okay, and this symptom will always prove that this is because of the retention of food. And the tongue, of course, you can see it's greasy. The pulse usually denoted by slippery. Okay, slippery and greasy. Okay, this is because the accumulation of food inside. So any food accumulating in the stomach, you will get a stomachache. Any food accumulating in middle jaw, it will cause the qi and blood moving unsmoothly. Okay, and this is what we call the situation by the food stagnation. Of course, these people will sometimes get diarrhea, sometimes get constipation, depending on which case. If the food undigested, causing the digestive system disorder, it will just get diarrhea. If we get too much stagnation in the stomach, but nothing in the large intestine, we got the constipation there. So it depends. However, the pulse will be shown by slippery. Okay, the tongue still will get the greasy. Okay, and here, how can we deal with that? Of course, what I'm going to do is the elimination. Elimination, that means increase the absorption, increase the digestion. Okay, so elimination, and then we got to regulate the function of stomach and also releasing pain. One important formula which I always keep in my home, which is 补和丸. You can buy in TNT, you can buy in any Chinese herbal shop. Anytime you get food stagnation, you get 补和丸. But here, besides 补和丸, we combine another formula called the 橡树散. Okay, those are the representative formula. Okay, 补和丸and 橡树散combined together can have a very good elimination power. The second is the liver and also stomach qi stagnation. As I mentioned before, the liver governs our hypochondrial vision. Okay, so people suffer from this syndrome will get distension and fullness, and this hypochondrial power, and also get bad temper, emotional disturbance, right? Because he got something wrong inside his liver, and this liver is liver qi stagnation. Okay, and always sign, and in English we got an irritation, but we express it sighing all the time because the qi stagnation inside the liver is very severe. Of course, the tongue condition and the pulse condition will agree with that by giving the wiry and slippery pulse. The tongue, of course, get the thin and white tongue there. And here explain why the patient always gets sighing, why the patient always get the pain along the epigastric position because of the liver qi stagnation. Okay, and how can we deal with that? Whenever we qi stagnation, the only solution is to get the qi moving, and also we get the activation of blood. So here we try to soothe the liver and regulate the stomach. Okay, after regulating by what? We can regulate the stomach function by regulating the circulation of qi, and then when the qi is moved, of course the pain will go away. So here, very important formula we learned before. We call it 柴胡疏肝汤. 柴胡疏肝汤. This 柴胡疏肝汤 is to soothe the liver by using this principal herb called the 柴胡. 柴胡can go into the liver and also go to the 消阳 channel to ventilate and also to regulate the qi there. And this is the example for that. And the third cause is because of the liver, stomach get the accumulation of heat. And with liver heat, you can just mention the liver heat because the liver will get the heat from dysfunction. If we get hyperactivity of liver yang, always get liver heat. The lung heat, the stomach heat is caused by the fire there. Okay, so what will be the cause of that? The cause of because you eat too much deep fried food, you got the heat, right? In Chinese, people just like to eat people like to eat the Kentucky chicken and the French fries. Those are the cause for getting the liver and stomach heat. Okay, in this case, you experience the stomach ache, and acute and sudden burning pain there. And also we get other symptoms, just like you get a bitter taste in the mouth, irritability, like drinking water. And the tongue, you can see the tongue is red, and also the coat is yellow. And also the pulse, also get the wiry pulse and also rapid. And here is a very important statement you guys need to remember. Excess qi indicates excess of pathogenic fire. But it doesn't mean that. What I mean is you're getting too much qi and then become fire. As I mentioned before, fire will not block from outside. Wind will not bring the fire into the body. The fire is caused by you yourself because you tonify yourself too much. You get much more qi than you need. So the excess qi becomes fire. Okay? And this fire accumulates in your stomach and also your qi liver. So it will become the heat. And this heat will burn up to your mouth, even your mouth tastes bitter, and also the mouth dry, and also your tongue become yellow, and also the red teeth there, the red tongue there, and your pulse, the wiry pulse also denotes the problem with the liver. Okay, how can you deal with that? Heat in the liver, we must solve it by, we must solve it by killing the heat. Okay, and the problem in the stomach, of course, will regulate the qi in the stomach, and then we will stop pain. So what we are going to do is use the 保虎汤. 保虎 means white tiger. The white tiger soup is very important to getting the heat from the stomach. Okay, and what's the cause of the stomach heat? The cause will be, smoking and drinking too much, overindulging in smoking and drinking wine. Okay, because those things will cause heat inside our body, and especially smoking will cause heat in your lung, while drinking will cause heat in your liver. So those are the main cause of that. So what are we going to do? Since the heat there, we must use more water. Okay, so we use the clear heat and adding more body fluid into these two organs. Okay, and sometimes when the heat develop more and more, it will become toxin. And this toxin will get extremely heat. This toxin will hurt the blood capillary in our stomach and causing what we call it as the blood. Okay, this is what we call it when we are coughing or when we are vomiting. We are vomiting with some undigested food with some blood. Okay, what we call it this hemiphilia, hemitemia. That means when you are vomiting, you vomit with both food, undigested food, and blood together. Okay, in this case, you have to clear heat in your stomach. So what we're going to do is use 银翘散, and yin fa and 连翘, those are the herb for curing the heat. Okay, so here is an example of that. And the fourth reason is because stagnation of blood. Blood stagnation is symbolized by the the pain, the fixed pain. The pain is also stepping pain, like a needling or cutting there. The pain is fixed. Here, as I mentioned before, for women, the later menstruation cycle and dark menstruation blood, menstrual blood, which is also a cause for that. So many women have their menstrual blood not only red in color, but sometimes with brown with some colored blood there. That means it is stagnated blood there, right? So you can see not only in your menstrual blood, also it displays in your tongue. So the tongue has some purple stain, or also some purple or blue stain. And some people will also find in the pulse, either this uneven pulse means choppy pulse. choppy and also wiry pulse. And this is also the symbol for the stagnation of blood there. Okay, and here you mention why we get heat in our stomach, because our stomach is the organ full of qi and blood. If we get more qi and blood, it will easily get stuck there. Okay, so sometimes hematemesis, that means you're vomiting with blood, or sometimes when you have a blood in your stool, mixed stool, those are really because of the problem of your stomach and your large intestine. Okay, and here you also mentioned stagnated blood and in the body and causing different symptoms. Just as I mentioned before, in the menstrual cycle of women, they got the stagnated blood, also got the clotted blood there. Okay, how can we deal with the stagnated blood? As I mentioned before, removing stasis. Okay, and treating the blood, not treating the blood, I think is moving the blood. Moving the qi, and also we got the activated blood, or moving stasis. This is what we are going to do. After doing all these three, the pain will be relieved. So there's a very important formula called 洗孝散. Again, 洗孝散 only contains two herbs, but these two herbs not enough. So we add one more called the 丹心饮 together. So what are inside the 洗孝散 and 丹心? As I mentioned before, 蒲王 and 五灵芝, 三蒲 and 五灵芝 those are the 四孝散. But we should add some more there. Okay. The fifth one we call it the insufficient of stomach yin. As the yin in the stomach is not enough, we are going to apply more water into it. But if there's no water, your stomach will have some burning pain and also weak pain there. And the other symptom will be constipation. Okay. And also when you see the tongue get not enough water, it will become dry and thin. The tongue always get a regular shape, but when you see some people get a thin tongue, just like a cat's tongue, that means this is because emaciation because of weakness. Okay, the red tongue always denote the thing which is yin deficiency. So whenever you see red tongue and thin tongue, this is also a deficiency. No coach at all. With the pulse, with fine and rapid pulse, it's surely 100% should be yin deficiency. Okay, and here I mentioned why we get the yin in the stomach deficiency, because there's heat. The heat burn away all the food, so we become deficiency in that case. Okay, and on the other hand, how can we solve the problem of yin deficiency? In Chinese medicine, the method is nourishing. Okay, so here we want to nourish the yin, and then we regulate what the cholesterol and also release in there. The formula we are using is 养胃汤. 养胃汤 is not enough, so we add some more 消炎, 甘草汤. Those are the modification, but we are not going to mention any modification. You guys just need to give the representative formula there. Okay, the sixth one I think will be the last one for me to finish before the lunch. Okay, and this is the yang deficiency in the spleen. As you guys know, yang is important because it's a kind of energy. If you do not have yang in your stomach, you cannot move the food there. So the food will be staying there inside, and the lung, so the stomach, we have some regular pain there, and or sometimes dull pain there. And then you get the cold food or you get the cold water, and then it will intensify. Okay, so that means that people like warm food and warm water. And his face, of course, has a very dull complexion, his forelimbs get cold, and even a little bit, it will diarrhea. That means what? That means the digestive system go on strike. It's not going to work. Yeah, anything, you just take out anything, right? And then the tongue always get thin. And whenever you see the teeth mark, it's always instinctively we got people getting teeth mark. Teeth mark is firstly because of dampness. Secondly, because of the yang deficiency. Okay, so we got deep pulse and also forceless. This means that this is weak. Okay, and this explains why the stomach get this kind of yang deficiency, because these people eat more cold food, more cold nature food. Okay, always in the summer. So we will make the spin cold, and also make the foot and also the hands all cold here, right? This will be the P. The spin yarn cannot grow there, right? And what are we going to do with that? Anytime cold, remember the word warm. Okay, warming the material and strengthen the spin. What we are going to do is 王旗剑中套. Those are representative for that, okay? And this is explain why we use that. Besides 王旗剑中套, we can have other in order to tonify our spin, okay? So this is the example. And lastly, this heat, and then we get cold, and then heat and cold, I think we can deal with other things, okay? So this is the end of this lecture, okay? I think it is time for us to take lunch. So we have 1 hour's lunch, come back at 2 o'clock. We have another 5 common disease to finish, okay? Thank you very much. Yes.